That brings us to the final award of this evening. Dr. Alyssa Jeanne Hart exemplifies what it means to be a family physician. As a faculty member at Hinsdale Family Medicine, she regularly educates her patients, students, residents, and colleagues with the greatest care. And she provides compassionate care to generations of families, including those who followed her from PCC to Hinsdale. She is nominated by a former resident, Dr. Nicholas Kesher, who has since graduated and moved on to Michigan.
Thank you for the Family Physician of the Year Award. I'm honored and humbled, particularly because, as you can see, there are so many amazing family physicians in Illinois making impacts in their communities, in legislation, and for their patients. I want to thank my parents, Carol and Al, for your love and for teaching me to do my best and to work toward the service of others. You've both led by example with your life that you created for your family. I'd like to thank my wife, Betsy, for your unwavering support through college, medical school, residency, fellowship, and beyond. You've been there through the best of times and the most stressful of times. You've always been not only understanding, but supportive of the sacrifices that I've made for my patients and for the residents I teach. I want to publicly recognize the sacrifice that you and all partners and spouses of physicians make in order to keep families and homes centered. I'll be forever grateful for your partnership in life and for our kids. And Olivia, Madison, and William, thank you for being the most loving and justice-minded children. You make me want to help shape a better and more just future for the three of you and for all children. I would like to thank the physicians that came before me and those that taught me what it means to partner with my patients and to listen actively. I feel a deep sense of gratitude to Drs. Levin, Jessen, Looning, Lakota, McCammon, all those at West Suburban and PCC that trained me starting from a third year as a medical student all the way through my early years as an attending. I want to thank my team at Hinsdale who've been supportive and flexible and open to making change, and for all the new ideas that you've come up with to better our patients' lives and resident education. Having care of the patient, resident education, and physician experience at the center of what we do has been the key to our success. Learning to partner with patients, to listen, and to meet our patients where they are is a lesson and a gift. Being a family physician is a gift. Being allowed to partner with patients in the most intimate of times, from the birth of their children to the end of life, is a gift. Being able to walk alongside and support our patients through their lives while helping address their healthcare needs and being attuned to a long history that may have impacted that individual patient dating back generations that may be rooted in systemic inequity that plays a role in achieving health is a gift and an honor. Having the opportunity to teach resident physicians during their 3-year tenure and medical students both in preclinical and clinical years is something I'm very proud of. I try to instill knowledge, empathy, and resilience in these young learners. I think about all of the teaching physicians out there, so many of you that have been honored today. And I can only hope that our values and shared wisdom has a far ripple effect. And for each learner's life that you've touched, that there will be a far reach for the tens of thousands of patients that they care for throughout their careers. Educators of residents and students will pass on a legacy of many great family physicians that came before us and taught us and paved the way to promote health and equity. In a time of such uncertainty, a pandemic, civil unrest stemming from systemic racism and inequity, and a time when healthcare disparities have never been more apparent, I feel so obligated to use my privilege to stand with truth and with science, to stand with the oppressed and the disenfranchised, to stand with those that do not have a voice or who have been silenced due to their color, sexuality, gender, ability, or religion. This is the time we must take action. We cannot be silent, and we must use our privilege and our voice to stand for our patients and to work actively towards closing this wide healthcare gap. I implore you to please find a way to take action for your patients and for your community. And I want to thank you again for this amazing recognition as Family Physician of the Year.
And congratulations. The Academy will submit you as our nominee for the American Academy of Family Physicians Family Physician of the Year in 2021. Best of luck. So I have to point out a pattern here of a lot of West Suburban family medicine folks influencing this year's award. So I'm going to give a virtual high five to Scott Levin for the amazing program that he's built there.